name is Boris Lassar, and I'm a registered psychologist with Supporting Wellness and Growth. Today we're going to be talking about psychoeducational assessment. Psychoeducational assessment is a process in which we determine whether the child that has been referred to me as experiencing difficulties because of their academic performance, their ability performance, or because of the behavioral and psychological issues. Why do children come to be tested? Well, there's a number of reasons. Sometimes teachers identify that there might be learning obstacles or problems that this child experiences. Sometimes it is the parents that are identifying behavioral or psychological issues that are interfering with learning or educational performance. Sometimes it might be both parents and teachers that have identified a problem and have deemed necessary for this child to undergo a psychological or psychoeducational assessment. So how does psychoeducational assessment works? Well, first I receive what's called a referral question. It is basically when a parent or a teacher tells me what they think might be happening in this child's life. For example, a teacher might say, this individual has difficulties with math, or the parents might say, we have noticed that our child can't sit still, that this person is constantly moving. We tried everything and we can't just get him to sit still. This is called a referral question. It actually gives me a clue into what am I looking for, what might be some of the possible issues going on. Second, I will do an interview with the parents or the teachers and with this child in order to get a little bigger picture or a better picture of some developmental background, maybe medical history, psychological history, learning history. I will also review some of the files such as report cards, teachers' reports, just to get a little better picture. Next, we are going to proceed to testing. It is a thing that most children enjoy very much, some less, some more. In testing, I generally administer a number of tests, and the whole testing lasts between 2 to 3 hours. Sometimes it is split into 2 days, just to give the child a little bit of a break between different tests. When I administer the tests, I am not only looking at what the child is writing or how they're doing, but I'm also looking at how they're behaving during the test, because that often can give me a lot of clues into how and what is happening in this person's life. Once when the testing is completed, I take the tests and I then proceed to score and interpret them. The results will give me some clues as to what is happening. For example, the ability testing, or what used to be known as IQ testing, will show me what are the areas in which the child is doing well and what are the areas the child is not doing well and might be struggling. The achievement testing shows me how the child is performing academically, at what grade level they are currently, or their age level they are currently performing. I compare the two to see whether there might be some learning disability involved in what is going on here. And finally, the third area that I look into is psychological and behavioral aspects of this whole procedure. It gives me insights into whether the reason why the child is struggling in school is behavioral or psychological. For example, if I identify that the person is struggling with ADHD, it gives me clues as to why perhaps they're having trouble learning math or writing an essay in school, or just having problems with learning in general. Finally, I write extensive recommendations both for parents and for teachers. The reason why I do the extensive recommendations is because I know that sometimes some things may not work. So I want to enable you as a parent or as a teacher to have a large toolbox from which you can pull different tools to assist your child or your student and help them succeed in their life. So the recommendations for parents are very specific. And sometimes they involve psychotherapy or counseling. Sometimes they involve behavioral management skills. Sometimes they involve practical suggestions on how you can help your child with the math, or how you can help your child with learning to read or learning to write better, or how to study. For teachers, I also write recommendations on how to do appropriate accommodations in school, but also how to make sure that the child is learning effectively and that they're learning from the materials that they're put before them. I also offer consultations to teachers to better be able to assist this child in school. If you have any questions, please visit our website at supportingwellness.com or contact me directly at boris@supportingwellness.com. Thank you for watching this video.